Hi, I'm Emily Dakers, Director with the Good Shepherd Barrett Center for Crisis Support, a residential mental health crisis intervention program in Hamilton, Ontario. We are a 16-bed residential program for any individual age 16 or older who may be experiencing mental health or addictions crisis. We accept referrals from any source. People can call our crisis phone line 24 hours a day to refer themselves or from any community partner through our referral form. Individuals that stay with us have the opportunity to meet with a counselor one-on-one for an hour each day that they're here during their 5-day stay. We like to focus on skills that we can build, referrals that we can complete, and connections that we can make for the people that are staying with us, who are often facing isolation and unsurety of what's next. We like to focus on crisis intervention, meaning we're not a shelter. We don't support with housing, but we do support with people getting connected to the right supports to help them get where they need to go. When people come to us, we ask them before they even get here, what are their goals? What do they want to work on? What can we help them with while they're here? So on the referral form, if you're completing it, it's helpful information to provide in advance. Also, what referrals have already been completed during their stay in hospital. When somebody gets here, they can be expected to complete an intake that takes about an hour and go through bedbug protocol, meaning all of their belongings will go through our dryer, be steamed or be stored to support with pest control throughout the building. People who bring medications with them should be in the labeled containers and will be stored separately by staff, but are not administered by medical staff. Therefore, clients need to be able to take their own medication at the times that they need them. We are a harm reduction-based program. Folks do not have to abstain from substances while they stay with us, but we do ask that they don't use on site. We do have a backyard that people can use where they can smoke. They can also come and go as they please throughout the day. We have a 10 p.m. curfew, but otherwise in and out privileges are open for people. If guests want to have visitors, they're welcome to do so, but we ask that they let us know in advance so that we can make sure there's a space available for them. Unfortunately, we don't accept partners, family members, children, or anything like that. It does have to be a single individual who comes to stay with us. Our rooms here are private or double occupancy. The most people that will be in a room is 2. We do have gendered spaces for both male and female identified individuals, as well as gender flexible spaces, meaning we can accommodate any other gender identity that may present. Our staff team here is diverse with backgrounds in health, human services, social work, and more, and all provide the same level of care, both across our crisis phone line and for our in-house guests. Meals are included. We have an open family-style kitchen where folks are able to grab food as they please throughout the day as they're hungry. We are able to accommodate any dietary requirements that might be needed, including halal, gluten-free, etc. We have hot dinners delivered 3 times a week, but otherwise folks are requested to complete their own cooking, microwaving, whatever it might be to support themselves. We are a semi-accessible facility, meaning that we have an accessible entrance and an elevator. However, being a big old house means that not all of our doorways are up to code. And so if somebody has a large mobility device, we usually try to have them come for a tour in advance to make sure that we're able to provide them with care with dignity, that they're not trapped in a hallway somewhere by accident. What you're seeing now is our intake space. We have dedicated intake workers 7 days a week who both complete the phone assessments with people and the intakes, and then guests are provided a tour through our spaces, including our kitchen and dining room, our TV room, our group room, and our backyard. Through our crisis and our safe beds, we work with a number of community partners, including local hospitals, including St. Joe's Psychiatric Emergency Services. We work with the police and the MCERT Rapid Response Teams, Coast Mobile. We also work with all of our shelter partners throughout the city and any outreach teams that may meet with people needing support for their mental health. Guests who access our service are also able to connect with our peer support worker who's on site 7 days a week, who completes programming, including art, skill building, and more, and our harm reduction worker who can support people after their stay with us, so long as they have goals towards their recovery.